study and its sister studies around the world, and the Gateway Project, which kind of make the data a little bit more easy to play with for you guys. So I think many of you maybe heard about health and retirement study, which started back in 1992. It started as a small cohort study um, of the birth cohort of 1931 to 41. And the vision was trying to capture the aging process of the Americans. And back then they started with um, household respondents who are living in the community, not including anybody in the nursing home. And they wanted to provide the data for the researchers, not only just for their own use, but to make it available for other researchers because it's using a lot of public funding. And they started such a way with a focusing on only one birth cohort, but over time they really became nationally representative. So that transition started in 1998, and starting from 1998 forward, they always bring the refresher sample in every 6 years and trying to make the cohort representative and follow them, their aging process over time. And they started with their core interview in every other year. But then they started supplement that core survey with various other ways. So first of all, they developed a questionnaire and leave it behind and collecting some additional information. And they also found out that over time, people have passed away. So they interviewed the family members, then capture the circumstances around their deaths, why they died and, cause of death or how the money goes with the inheritance and bequest and various elements of it. They started having that end of life interview, which is a very unique data that has not been, very much exploited yet. They also have started to bring in health assessment and biomarker data back in 2002. And that provides like a completely new set of data users. So previously, when the health and retirement study started, it was driven a lot by economists and demographers and sociologists. But with that 2002 bringing the blood biomarker data, all of a sudden the whole wide community of epidemiologists and the people who are interested in medicine became a users. And then they follow them again in every other way. So biomarker data is, because it's so expensive, it's been collected in 4-year cycle. One of the most exciting new development in this HRS study has been collecting the health, what is called HCAP, harmonized cognitive test protocol, which Arden will be discussing. So I'm not going to go in there, and because Arden is an expert on that, and he will tell you all about it. Because HRS has been so successful, the model of HRS has been really transferred around the world. So as you can see, the colored countries are the countries with health and retirement studies, and you can see the list of countries that has HRS survey right now, collecting data over time. So let me tell you what kind of makes health and retirement study, because there are so many aging studies actually around the world. And we call some of the studies really sibling studies, and there are some cousin studies for sure. But I think the important characteristics of worldwide health and retirement study is all of these surveys are population representative. It is very important to say something about the Americans or the English or Germans, and having that sampling frame to make recommendations for policies is a very key element that distinguishes health and retirement study from other aging surveys. And another important component would be it's a longitudinal survey, so it allows study aging processes, and the topic-wise is quite multidisciplinary. So original vision of it is there are so many in-depth studies of economics or in-depth studies, epidemiology and so forth. But back then, there was not a single study that touches all different aspects of the people's life. And as you know, our lives are really intertwined with our work and family and social lives. So that's sort of the very important vision that HRS kind of distinguished itself from other studies to make that multidisciplinary. And it also trying to capture very high quality economic data, but also bringing biomarker data, as I said. But one of most important feature of this HRS family of surveys data is in the public domain. So everybody should have access to it. And some of the like epidemiology tradition, people keep the data very close to their heart. So that's not the model here. So in order to work with us or work with this network, the public data release is very important and it should happen in a very timely manner. So everybody, all the PIs are really trying to push the data out within a year. So that's a big plus compared to the other studies. There are a list of, as we talked about the multidisciplinary nature of this study already. So as you can see, there are a variety of different topics the survey covers. So when the HRS went to the world and what makes it very important for us to think about cross-country analysis or think about some comparative approaches is that this network of studies let us tackle some of the common research questions. So, very basic process of aging. Now, I think it is very common that we all know we are getting old, right? That's sort of a universal process. But at the same time, you wonder, aging in one country makes it more vulnerable to certain things. Those are the questions that people are trying to understand. And in order to also using these surveys, we try to see individual level trajectories, but we also want to see the trend across the population level. And as you know, disparity is very important matter. So a lot of the studies trying to oversample the minority samples to getting into what makes certain population more vulnerable than the others. And because this population representativeness, the thinking about impact of policy has been always very, very important. And then when the studies go to other countries, it's very important to think about different contexts. So, and both socially, culturally, program-wise, and bringing this different context also gives us an opportunity. So what all of those common research questions led us to think about it is when we talk about aging, what would be the right age threshold? Because aging starts at when we are very, very young, but life expectancy varies so much compared to one country to the other. So I study a lot about India. So life expectancy in India is like just over 70. But I'm originally from Korea. Korean woman lives the longest life. I'm very happy about that. And it's completely different outlook, right? At age 60, are you going to live another 20 years or 30 years or 40 years? So you tell me. So a lot of times people think about those things, and when they even design the sample in order to measure the trend, they bring the pressure sample. But at the same time, because it's a longitudinal study, you have to be mindful about the cost. So a lot of sampling is done in cluster design, so you can follow people. Instead of going all over the country, going to the clusters. Then when you analyze the data, you got to account for those kind of sampling frame and in your analysis. So a lot of things also having very important policy implications. In order to make that happen, a lot of dialogue with policymakers and also local experts because they really know the context. But then you worry about the subpopulation level sample size. If you want to say something about minorities or certain ruralities or whatever the research question is, making sure enough sample size for those things would be quite important. And many of the countries have tried very hard to also think hard about the unique circumstances and opportunities. So over time, now there are now 47 countries that has health and retirement study. So there's a lot of varieties that you can study the circumstances of aging in these countries. And let me just tell you a little bit about the innovations that some of the studies brought in. And these are not all the surveys. There are many other surveys also happening, but these are like has some very important strengths that would be worth mentioning. So English longitudinal study of aging started back in 2002. I just came from London actually. Last week we had the 20-year anniversary. So that was really cool to have that 20-year anniversary. It's a very special survey in a sense that their funding comes from half of it from the US NIH and the other half comes from UK government. And when the study got started, it was actually the vision of NIH. They want to learn about how Americans, age process, their health and well-being would be compared with the English. And they actually went to England and trying to recruit researchers, raise the funding with the government, and then make that happen. When they started, so also it kind of goes with some of the histories, right? I feel old now talking about histories, but when HRS started, it was a single PI project as an economist leading a PI. So it was very heavy econ content. When HRS mother exported to England, the British PI was actually Michael Marmot, who was very famous social epidemiologist, and he brought in two other PIs to the ELSA project, who has a background in medicine and another one background in psychology. And the third one on the economics. So you can see the ELSA all of a sudden has become very balanced project, and they introduced for the first time, bring the biomarkers, and they also brought first time Live Behind questionnaire that has the whole list of psychological variables and personality measures. So with that 2002 ELSA's innovation, HRS adopted both of those measures. So HRS started putting the Live Behind questionnaire in their own survey, and then also started collecting blood-based biomarkers. The SHARE, the Survey of Health, Aging, and Retirement in Europe, is another very important project, and they started in 2004. And this particular survey is largely funded by EU, and their goal is really trying to go after every single EU countries in that project. And it's much shorter survey because they have to administer this exactly same instrument in France and Germany, but also in Croatia and Spain and so forth. So, it's 28 countries right now, a lot of negotiations. So whenever, you go to a share meeting, it's like seeing a lot of diplomacy, right? A lot of negotiation, and things get trimmed down because everybody wants to put their baby measures, and when you start allowing that, it gets just bombarded, right? So the PI, Axel Bosch's fund, decided not to take that route, and he just stick with a very core instrument. But very important innovation that SHARE has brought into this HRS family of survey is actually life history module. And Tristan is going to talk about later on SHARE's life history module, but this is actually very unique in the sense that utilizing calendar method, showing how people's all your life has been thinking about that and relating that to their work life, family life, childbirth and so forth. There has been a study that kind of calendar-based method is very powerful in the sense that data accuracy is higher instead of just asking that prospective questions, but also it's kind of lighten up the respondents because getting respondents agree to talk to you is very hard thing. If somebody asks you to fill about even 5 minutes survey, that's very hard, right? I don't know. I appreciate my respondents very much, but it is a big challenge. But when SHARE introduced life history, people really like to talk about their life. And it kind of changed their life response pattern completely. So after that, whenever the SHARE they started bringing a new country, they actually start with a life history, just trying to get them, wed into the project. So that data has been utilized, and we have now transformed that data into a sequence model. So to speak, so you can see at every age what is their marital status, health status, work status, and you can model it in a very variety of creative ways. So I think that's very important data resources that you can tap into. Another very important study would be the Mexican study. So Mexican study actually started 2001, but there was some issues with the funding and PIs and all of those. So after first two waves of MS, they have a long interval of like 10 years. And then, but amazing thing is after 10 years, they went back and tried to find respondents. They were successful. It was I couldn't believe it. And people didn't move around. So they were able to follow back. And now EMAS, since then, has a lot of high quality data. What distinguished EMAS from other HRS family of surveys has been more about that allowed making a lot of comparisons, especially thinking about immigration, right? There is Mexican immigrants are coming into the US, and many of them go back to their own countries, others stayed in, and it kind of created a whole stream of research on immigrant health. So I think in that regard, it is very interesting study. I have not listed it here yet, but we are working very hard to bring Canadian data to this family of surveys. So there is a study called the CRSA, Canadian Longitudinal Study of Aging. They started as more of like an epidemiological study, focused a lot on the health outcomes and not releasing the data to the widely, but they have changed their models now, trying to opening up a little bit. And I think that will make another US, not only Mexico, but US, Canada comparison possible. The fourth study is a Korean longitudinal study of aging. I had a great pleasure, or I suffered a lot to develop this closer baseline, and my Korean colleagues took it over. It is sort of very challenging, and in a way that you think about bringing HRS and to country like Korea, it is a first Asian country. So I had no intention to do that, frankly. I only did it because my mentor asked me to do it, and he was very, very, very firm. So, but I struggled a lot, and one good thing was with CLOSA is after my time, I did a pilot and then I did baseline. But what happened to the survey is the government agency took it over. So what that means is they have a very good high retention rate, but they didn't change instrument. So there is no innovation, but at the same time, if you want to look at something longitudinally, it's terrific. There is no changes. So you can actually see all of people, right? And see the patterns change. So I think CLOSA has its own, strengths in that regard. CHARS is like one of most utilized survey. And the CHARS PI always like show the graph how the CHARS data is utilized more than HRS sometimes. So it is very important resources for the community for sure. I'm one of the PIs for the Indian data, longitudinal aging study in India. We just released the data a few years ago. We only did the baseline. We are currently working on getting the data wave 2 started in the field. India is such a big country. So I think one of the strengths for the LASI is our sample size. So we have over 73,000 sample. So danger is it, whatever you learn it, you'll get the significance, right? But what the significance means, you have to really think about it twice. And I think one thing that you can consider many people don't use it is actually LASI pilot data. So we did a very serious pilot back in 2010 from 4 different states in India. And at that time, we trying to bring the representativeness in those 4 states. And by the way, LASI is not only representative of the country, but also each of the states. So you could compare the changes, at least the trend in those 4 states. And I think that is a important strength for the LASIK project. So we are hoping that we'll get this second wave done for LASIK. Our goal is to get it done within 2 years. But we need to just get a lot of stamps from the government. So that which none of the PI has a control over. So that's especially next year we have an election. So we are just kind of it is very interesting mixture. I want to mention Tilda. Tilda Island is a very small country, and but this Tilda is one of the most well-funded study, and the PI is a geriatrician, and her heart is in the biomarkers. So if you look at like Tilda, you can find all kind of like cool jazz. So they have something called the magic carpet. So what it is, you kind of walk through the magic carpet that it measures the walking speed, it measures like the, all kind of biorhythms. I mean, I don't know what all of things they capture, but they have the eye exam, they have like it's sort of mild smarter, right? So they bring the respondents to the hospitals and then they stay overnight and they do all kinds of tests in there. So if you have an interest in the health markers, Tilda is a very important and good resources to tap into. The access to the data has been a big problem in Tilda. So Tristan and I had a meeting with the Tilda team. They are working very hard, and the PI is actually meeting the congressman in order to make the data more widely available. What we heard is because a lot of these companies doing the web-based work, all based in Ireland. So the regulation is much steeper than even other EU regulations, but they are working very hard. And the goal is we'll make this Tilda data available to much wider audience by end of this year. Sorry. What happened? Okay. So now, because there are so much data out there, what we are trying to do is trying to make this data more understandable for the project. And that's what we call it Gateway to Globalizing Data project. And in a way, our mission has been really trying to make the data available, information available, because, learning about one data is a challenge. You're trying to learn about 2 different surveys or 3 different surveys is a real challenge. So we're trying to make that a little bit more easy. We do a lot of data processing. So in the afternoon, Tristan will tell you more about the processes we go through, how can you, so there will be a lot of transparencies in terms of how we clean up the data for the users. And then, so kind of helping you doing some of those legwork so you can jump into the actually analysis a little bit more quickly. And we offer a lot of information, especially creating a easy to use single data file that merges all different longitudinal waves and providing the information about that data file and also highlight utilizing some of those already created data. We can create like graphs and tables, you can see it on the screen. So that way you don't have to even download the data, looking at some patterns and see whether there is enough sample size, whether there seems to be some trend or associations, whatever you want to look at it. We have built a lot of our IT team built concordance search engine that identifies the relevant topics, questions, but also publications that comes with it. And our newest initiative is trying to bring policy information to this. So our idea is really coming from how we can contextualize the data, survey data. And we started from just very simple information about the general economy or life expectancy, unemployment rate sort of information. So you don't have to do it, search for such information. And we are just basically doing the legwork for you. But then we started going into further contextualizing the environmental information. So not just getting into especially the policy side of things, getting historical policies, getting into the pollution, physical environment, the more chemical environment and climate changes. So let me tell you a little bit about what we are currently working on. So first of all, the policies. So when we think about the policies, today's policy really influence how we make our decisions of today. But if you think about the outcome measures, then you need to worry about how those outcomes came up. Maybe there are earlier policies that made people to behave a certain way, and such behavior will lead to the policy outcomes. So that's one of the reasons why we're trying to trace back the historical changes, and we have worked on collecting those historical informations for the key countries that we have in our data files. So you can just come to our website and all of this information is available for you, and both at the level of country in terms of the details or more high level information across different countries. So if you click, for example, pension policies, especially spousal benefits of France, you can get all the detailed information about when this was first instituted, which year the reform has been, and when policy reform happened, what are the major highlights of those policy reforms. So we have a large army of the research team, and they collect this information. And then once we put together the basic document, we identify the country experts, and country experts review all the documents and provide us feedback. So we have a country expert for each of these topics, and topical areas, both pension. We started with pension, and then now going into other policies. So what we are doing is based upon those policy information, we are actually building a variable. So I think the easy example is the statutory pension eligible age. A lot of economists use that, right, as an instrumental variable for retirement. And we create that for individuals in our data set and create the data file, included it as a part of the survey data file. So you can utilize that information for your own research. We are now taking that a step further, not only looking at the statutory pension eligible age, we are also collecting, creating the variable for benefit amount. So that's, again, see how attractive those pension packages would be varies across the countries, and you can compare it whether that influences the retirement behavior, of course. And our current policy initiative, and especially this project cycle, we're putting a lot of efforts on long-term care policies and collecting information on various eligibility requirements. For the US, actually, we are going after state level information. So we are in the process. Some of the information, we are releasing it as it became available. Because this is all, based upon the legwork. So this takes time, and we are adding each country at a time, each state at a time. We're also working on the education policies, another important initiative for us, getting into information about compulsory schooling reforms across different countries, and also alternative pathways. So there are a lot of literature on actually compulsory schooling and child labor laws, but there's not enough information about the education quality or different pathways, right? Like the German system, you go to certain science track or vocational track. So we are trying to capture those kind of alternative pathways, who makes the decisions, at what age such different pathways have been determined. So if you are interested in education, I think this is a very interesting area to do some research. And then our another important initiative is environmental data. So we have started with a PM 2.5 and getting into pollution measures of PM 2.5. Now we added to source-specific PM 2.5, NO2, and NO3, and getting into other measures. So let me tell you about why it's important to think about pollution, not in just within the country, but across different parts of the world. As you can see, this graph is showing you PM 2.5, the measures that we have created. So the way that we create this exposure to PM 2.5 is we started with the satellite data and then combine the satellite data with the ground monitor data in each of the countries. and then integrate those with other physiological changes or the layout of the country, and utilizing those typology information, load patterns, ground monitor data, and satellite data, create the estimates to exposure to PM2.5 at 1 kilometer by 1 kilometer level. Of course, I didn't do it. We have a, I have a colleague who is at in UK. His name is Gavin Sheddick, and Gavin has been working for WHO, Global Burden of Disease, on the pollution side of things. His global model is already available in the, on the WHO website, but that estimate is just based upon the satellite data. And it is for the precision is 10 kilometer by 10 kilometer. So what he did for our project is bringing those local ground monitor data and typology and load pattern information and increase the precision to 1 kilometer by 1 kilometer level. And what we are doing with the country team is actually linking that data to the survey data. So as we have completed that for the LACI, the Indian data. So we are pushing out our first papers looking at the air pollution impact on cognition. And then the ELSA team is also completed their PM 2.5 and also Irish team. So it is really cool to have those kind of exposure measures and linking that to the survey, individual level survey data, so you can kind of really study health effect of pollution at individual level using this sort of information. Another, the space that we are currently working on is getting into green space and blue space, which is access to the water, the ocean or the river and so forth. There are a lot of data available already in high-income countries. So that's mainly grabbing the information and linking it to the survey data. So you can see how those kind of physical environment influence the mental health, especially. I think there is a lot of evidence on that. More kind of exciting and new area that we are trying to getting in is actually low and middle income countries, because there is no such data available right now. So we have two different teams. What they are doing is trying to utilize aerial imaging data. So we take a lot of pictures and trying to, from those pictures, utilizing AI, machine learning approaches, and trying to identify some of the key indicator that matters for the environment. So the work is going on by two different teams, one at Minnesota and another one in Northern Ireland, and they are both independently working on it, and occasionally exchange ideas with each other. And then the last initiative we are working on is actually climate initiative. So the challenge in the climate space is the temperature data is so rich and it's just huge. So you have to think about what are the indicators that you want, because you can have a temperature right now, right? And you can have an hourly estimate or daily estimate and so forth. So what our methodology team is to think hard about, what would be the right aggregation? Should we talk about the number of days over the high temperature or really cold temperature or for the precipitation? So more of we are at that stage of thinking hard about, how we can capture the climate to think about that influence on the health outcomes. So thank you very much.